Here is the latest news from Burkina Faso.
In recent years, one of the most remarkable initiatives introduced under President Ibrahim Traoré's leadership in Burkina Faso has been the integration of traditional medicine into the public healthcare system. For decades, African societies have relied heavily on herbal remedies, ancestral knowledge, and community healers to cure illnesses long before modern hospitals became widespread. While modern medicine has made great progress, traditional medicine still plays a crucial role in rural and urban communities alike. By recognizing this fact, the Burkinabe government is taking a bold step toward creating a healthcare model that is both modern and deeply rooted in cultural identity. The decision to integrate traditional medicine is not just about honoring heritage, it is about practicality and sustainability. In Burkina Faso, as in many African countries, large segments of the population still depend on herbal remedies because hospitals and pharmaceutical products are either too expensive or too far away. A bottle of modern medicine may cost a day's wage for a farmer, while herbs from local healers are affordable and accessible. By officially integrating these practices into public hospitals and health centers, the government ensures that no citizen is left behind simply because of economic or geographic barriers. Another key factor behind this initiative is the immense potential of natural medicine. Many modern drugs are derived from plants that traditional healers have been using for centuries. For example, quinine, used to treat malaria, originally came from tree bark. Aspirin was inspired by willow bark extracts. In the same way, African herbalists possess knowledge about roots, leaves, and seeds that can cure fevers, infections, and chronic diseases. Unfortunately, much of this knowledge has remained informal and undocumented. By bringing traditional medicine into the public health system, Burkina Faso can preserve, research, and improve this treasure of indigenous wisdom while ensuring safety and scientific validation. The government's plan includes setting up specialized departments within hospitals where trained traditional practitioners can work side by side with doctors. These units will not only provide treatment, but also facilitate collaboration between herbalists and scientists. The idea is to test and standardize herbal medicines, ensuring they are safe, effective, and free from harmful side effects. Patients will then have the choice of combining modern and traditional approaches for a more holistic recovery. This represents a significant shift from the old attitude where traditional healers were seen as rivals or even illegitimate. Now, they are being recognized as valuable partners in the fight against disease. The cultural impact of this move cannot be underestimated. For many Burkinabe people, healing is not only about the physical body, it is also spiritual and communal. Traditional medicine often includes rituals, prayers, and practices that strengthen the patient emotionally and socially. By acknowledging this, the healthcare system shows respect for people's beliefs and traditions, which in turn builds trust between citizens and medical institutions. When patients feel understood and respected, they are more likely to seek treatment early, follow medical advice, and recover faster. Of course, challenges remain. One major issue is the need for proper regulation. Not all herbal remedies are safe, and some can even be harmful if misused. The government must therefore establish strict guidelines, research centers, and quality controls to separate effective treatments from harmful myths. Training programs will also be essential to educate both traditional healers and modern doctors about how to collaborate effectively. Funding, infrastructure, and public awareness campaigns will play an important role in making this integration successful. In the bigger picture, this policy also speaks to Africa's broader vision of sovereignty. By valuing traditional medicine, Burkina Faso reduces dependency on imported pharmaceuticals, which are often expensive and controlled by foreign companies. Instead, the country can invest in its own natural resources, its own knowledge, and its own people. This builds pride, self-reliance, and resilience in the face of global health challenges. In conclusion, Ibrahim Traoré's decision to integrate traditional medicine into Burkina Faso's public healthcare system is more than a reform. It is a revolution. It is a revolution. It bridges the gap between modern science and ancestral wisdom, between rural villages and city hospitals, between affordability and accessibility. If executed well, It could become a model for other African nations to follow, proving that development does not mean abandoning tradition, but rather embracing it and transforming it into strength. This initiative has the power to not only heal bodies, but also restore dignity and confidence to a people determined to shape their own future.